Welcome to the Chinese Medicine Podcast with your host Marie Hopkinson, Chinese medicine practitioner.
Hi, welcome back to the Chinese Medicine Podcast. I'm Marie Hopkinson. I'm a Chinese medicine practitioner, and today I'm joined by another Chinese medicine practitioner, Holly Carruthers, Dr Holly Carruthers, and she is a special interest area in Chinese medicine for kids, for babies, children. So today we're going to be talking about children's health and how Chinese medicine might be able to help in lots of different areas of children's health and illnesses and things like that. So welcome, Holly.
Thank you for having me, Marie.
Yeah,
this is great. Really happy to get the Chinese medicine for children word out there.
Yeah, there's so much that Chinese medicine can do for kids, and I think one of the things I come across is people just don't know. They don't realise.
Right. Yeah. That's right. Yeah, a lot of mums, a child's unwell and the first point of call is Google, and then after that is the doctor. And sometimes there's an opportunity to help a child before needing something stronger, like antibiotics or further intervention like a specialist. And I think that's where Chinese medicine is so powerful, is that it's a non-invasive, gentle, pleasurable technique for a child. So they're quite happy to come along for a session.
Awesome. Okay. So what are the most common things that people come in, or parents bring there, because I'm sure that babies don't toddle into your clinic by themselves yet, but what are the most common things that parents ask you about for their kids?
Yeah, great question. Skin conditions would be a big one. Things like eczema, fussy eaters and digestive disturbance. So that can be something like colic for a wee baby. Or it might just be constipation or chronic low appetite for an older child.
Yeah. Okay.
Yeah.
And another thing that probably parents are thinking, as soon as you say acupuncture and children, you think, well, can kids one question I get a lot is, can kids even have acupuncture?
Yeah, it's not my first go-to. The great thing with Chinese medicine, I think that you've referred to before, Marie, is that we have a massive toolkit. There's so many different things that we can pull on. So the main technique that I've had extra training in is something called Shonishin, which is Japanese for needle-free technique.
Wow, okay.
So it's a very light, gentle therapy where I use a tool made by a blacksmith in Japan. So for the boys, I call it a sword, and they're really excited. And for the girls, it's a magic wand. Like, where's the magic wand going to go on you today? And that's used in different body parts, stroking techniques and vibration techniques on acupuncture points rather than using needles.
Yeah, awesome. Okay.
There's a couple of conditions that I will pop a needle in instead, and that would be something with a very hot condition. So fever, or if they've got very red, very agitated eczema, something that's really about to burst, that's when I'd use acupuncture. And it's in and out for a child. Whereas an adult, 20, 30 minutes on the table? Yeah. Only my big kids like a long time they lay there. It's still only 10 or 12 minutes.
Okay, all right, awesome. Yeah, because I think a lot of people think, if I've had acupuncture, my experience would be what my child might get, and it is completely different, the kind of the length of the treatment and exactly the style of treatments that you do for children. And I guess another thing that is really interesting about Chinese medicine for kids, maybe you can help explain that to some of our viewers, is that why do they get so hot? Why do they get so red?
Yeah, great question. So children are very relatively excess in what we call yang energy, and that's the energy that plants use, Mother Earth uses in order to grow and develop at a rapid rate. So that's a stage of life where they're using so much yang energy to get taller, to increase metabolism, to grow and develop in life cognitively and physically. And so because everything's happening so much faster, there tends to be that bit of heat that's generated. So you'll know if a child is out of balance in that area, in that maybe their face will be red, they'll have red cheeks, red lips, and they'll be very quick to anger or irritation and tantrum. They just blow over into something that seems irrational or because there's that tipping point is very different to adults.
So it's about maybe they haven't had a chance as well to learn how to control their emotions, right? And the yang kind of pushes that out easy out of control, just like an adult can get out of control. Yeah. Sometimes for adults they have exuberant yang or out of control yang, and they are so angry and so frustrated.
That's right. Yeah, that's right. And I think that's a great talking point on the importance of having downtime for children. So much of today's life is busy and living in excess of go to school, after school activities, after school daycare, and so the children aren't learning that time to relax, self-soothe and ground, and they're constantly going. I think that's an important note.
Yeah. So can children meditate? Can they learn how to do those kind of things?
Yeah, sure, yeah. And one of the greatest things with the Shonishin treatment, the needle-free one, is that the results are instant in terms of the relaxation.
Yeah, right.
The light touch stimulates the C nerve fibers, which releases oxytocin, which is that love, attachment, relaxing hormone that's produced in early bonding and pleasure. And so within a minute or two of the treatment, you see the child just melt into their session. So I think that's a great technique. I treat a lot of kids with mood disorders of anxiety or just when the mother and child or parent and child are finding things difficult behaviourally.
Yeah. So if people are watching this, because I have a lot of watchers that are not in our, because we're both in the same hometown in Perth, Western Australia. So we'll pop the link in the description below about Dr. Holly's business and her clinic and that. But if you're watching this and you are like in a, let's say you're in another country, because she can't do acupuncture or Shonishin through the internet yet, but we're working on it. But until that time comes, what about people that are thinking, oh, this treatment sounds really good, but I'm in like the US or I'm in the UK, and what's that treatment called? Do other people do that as well? Like, are there people around the world that do that?
Yeah. You would just want to make sure that the person that you seek out is really experienced with kids. They might use something like Twainer or acupressure, moxibustion, all techniques that are commonly used in Chinese medicine. It's just really important to have that skill of being able to build rapport and safety with a child.
It is, yeah.
Because you need them to have the treatment.
Yeah. They have to come back, and often they don't not just one treatment, right? It's a few treatments that's needed.
Well, the great thing with children is they respond pretty fast. Yeah. So it can be one treatment or it can be 4 treatments, depending on the severity. But if I've had to see a child any more than 4 times, that's a complex condition.
Okay. So it's a lot less than an adult.
Much less.
Okay.
Yeah.
Right. That's good to know.
And much shorter as well. The physical treatment time on a child is 5 to 15 minutes, whereas an adult will have their acupuncture points in for 20 to 40 minutes.
Yeah, okay.
So the total in-clinic time is 30 minutes, which is enough for a kid. They don't want to be there any longer than that.
That's true, They're climbing the walls over there. You probably don't want them in your clinic any longer than that. That's right. Oh, that's good. That's really good to know. All right. So what are some of the things, I know you've brought along your special little man today. I can see that.
This is Charlie. So he's special because his head is weighted like a real baby.
Oh, wow.
So it's designed for training to help us with baby handling skills of how to support a baby's neck.
Yeah.
So I learnt from a German paediatrician and Chinese medicine doctor, osteopath, naturopath, Thomas Wernick, and he taught us this technique, which is all about baby handling from an early age or infancy. So never hold a child like this.
Okay, right. Fair enough. I don't have any kids. I'm learning to.
Here we go. So with an infant, we're talking littlies, ones that
so this would be replicating a newborn baby.
Exactly. There's really only 2 positions that you want to hold a newborn baby, and that's this one because they're supported, there's chest on chest, and it's comfortable and everything's fine. The other one is the football hold, which they're looking down at the floor, which means that they're not going to be overstimulated, because if you hold a baby like this, they're looking around and they're taking in millions of pieces of information at any one time. So if you want your baby to sleep, don't overstimulate them.
Okay. Yep.
Get the broader the better, because they're going to be getting enough stimulation from very, very simple things. Plus, this position also helps to engage the baby's back muscles, because if this child wants to look around, they need to contract the muscles on their back and their neck to look around. Whereas if they're doing like this is a very passive position. They're not learning or doing anything other than
Yeah,
being
so they're not
overstimulated.
really needing to use their neck muscles if they're
Exactly. This is also very good for their digestive system. And as we know, children have a very immature digestive system, something that's much more delicate than an adult. So this position is quite soothing for a child's tummy.
Excellent.
Plus, for busy mums that have 2, 3, 4 children or more, this is tummy time on the go. Because tummy time is something that's, I don't think, spoken about as much as it should. So the guidelines for tummy time is 10 minutes a day for a 4-week-old, 20 minutes for 2 months, 30 minutes for 3 months and over. So that's actually quite a lot of time. But babies are spending more time in bounces, carriers, child swings and the pram, that they're missing out on that floor time, which is where they're going to crawl, where they're going to meet those milestones, which then help them to read, write, and from everything moving forward in life.
Super important, because it's I guess on tummy time the baby could start moving around, and it might be more convenient for the mum to put them in one of those jumpy basket things.
Don't mention the jumpy basket.
I don't have a kid, but I've seen those jumpy jump things.
Exactly.
And they put them in there so that I don't have to. Not that they don't care, but they're just like that. There's in a way like they're not going to go anywhere. They know that they're there. Yeah,
that's right. It would be preferable to set up a space in the home. You know, either if you need to have a baby gate or a pen, something where the child can explore of their own. A child should be, they're naturally engaged and wanting to grow and develop and learn. And so if you can keep that space clear of multiple things, so they've just got a few things to focus on. Once again, that importance of not overstimulating them. Yeah, and change it regularly. You know, each day pop something new in. It might be a kitchen spoon or a new toy, something that they can play with, and you know that they're safe while you are in the kitchen.
And this is for how old, like what age babies would this be for?
As soon as you can. Yeah. Probably more realistically 2-3 weeks, something like this. Hard, firm surface, you know, nice warm surface. That's important for kids. Yeah,
great. Okay, good. So,
And then the other thing with young babes is how to roll them over. So when a child is laying in the supine position, belly up, most parents will think to support the child's head while lifting and picking the child up. So that would normally look like this. And that's fine, but there is a better way to do it, in that a way that is going to help them develop moving forward, knowing that where their midline is, so they can be ready to roll, then ready to crawl, walk, and then read and write. So that looks like this. You roll the child onto their side, and then you create some tension by pushing down on that hip, and that shoulder has taken the weight of the infant's head, and then you bring them up onto your shoulder from there. That movement of moving them from their back to their side is starting to teach them, hey, this is how I can roll and this is how I can move, and that's going to help them with that next step. Same thing when you put them down, their shoulder is supporting their head, they come down onto that side and then gently rolled back into that back position. So it's a slower movement, and it's really encouraging them to use their muscles and participate in the action of getting up and down.
Oh wow! So that was amazing. To help kids to learn how to develop better, those lifting techniques can be better for them, right?
Yeah, absolutely.
So they can help their development and help their muscular development.
It'd be great if that was shown in hospitals and birth centres, so mothers and fathers learn that from day dot.
Yeah,
that would be really
And
awesome.
is this something that you help teach parents when they come to your clinic?
Yeah, so if I've been supporting a mother throughout her pregnancy, or they bring a young baby to me, absolutely, I'll always show them pick up techniques, because they're having to do that in the clinic to take the baby's clothes off and things like that. I just show them at that time. Yeah.
Okay, great. So you mentioned before about common things people come in for, and that digestion is a big issue with kids. Can you talk a bit more about that? Maybe some people at home are sort of wondering, are there things at home they can do to help their kids in Chinese medicine?
Yeah. So with children, if the if the flow from top to bottom is clear, that means that the flow of qi that we call in Chinese medicine is free. And when there's free flow and everything's in balance, health is our natural state. So if there's constipation or food accumulation, which is maybe being overfed for settling, or you're running around and just throwing food back, we all do it, and that food accumulates in the tummy and the tummy gets overloaded, there's various massage techniques that parents can do at home to support their children. So that looks like from the base of the rib cage to the belly button where the stomach sits, you can use very light downward motion massage on that point to help to empty their stomach. So for children who have got digestive issues, people can do that before feeding and after, in the help of, okay, let's just get the previous meal moving out and down.
Yeah. It's like kids get like the same as an adult would get an all you can eat, go to an all you can eat buffet.
Exactly.
But they don't get, that doesn't take much for them to get to that point, right?
Exactly.
Because they're learning how to know when they're full, when they've had enough.
Well, the great thing with kids is if you watch a child, they'll eat, they'll poo, they'll eat, they'll poo, they'll eat, they'll poo. With adults, that over the time and the years of food going in, that process slows down. But in a child, you see it just moving through. So if they miss one motion, that's a backlog.
Okay, right.
Yeah.
Okay, well that's a good thing for parents to notice, because they're obviously changing the nappies, they're going to know whether there's a poo there or not.
Exactly.
Yeah. And so are there things about their poop that the parents might notice that would mean something in Chinese medicine about what's going on?
Yeah, sure. So it just gets tricky when teething comes into it, because when teething, you've got smell, you've got green, you've got explosion, and that can simply just be teeth. Otherwise...
Why is that in a Chinese medicine sense? Why is that the teeth? Why is it going green and smelly and explosive?
Coming back to that heat part, it takes so much energy to push a tooth through a gum that internal heat tends to disrupt the digestive system. So that's the smell, that's the explosive. And you'll often see a child when they're teething, they'll get one red cheek. When you see two red cheeks, you know that it's food and it's not teeth. One red cheek, teeth, two, food accumulation. And that's where you do the tummy massage. Try and include more fluids and things like grated apple, figs or prunes if they're old enough for solids, all mixed into purees are really great at just clearing it on through.
The massage doesn't have to be very hard either, does it, to be effective? No. It's quite light. It's not...
the lighter the better. Exactly.
Because sometimes I find people that I talk to are a bit scared about doing massage on their kids because they don't know what to do. And they're scared of doing it too hard or not, and so they don't do anything at all. Yeah.
I think parents have really good intuition with kids, and physical touch is such a gift for a child that as long as you're touching and connecting with your child, that's healing in itself.
So there's no better people to do it than, like, the parents are better than the practitioner, because they're getting that connection with them. Right?
And I just thought I could mention as well, while we're talking about bellies, is one part of a palpation process that I do when children come into the clinic is to check for areas of hotness and coolness on the tummy. And parents can do that at home as well. And if you feel an area of cool, it can be as simple as having a game with a hairdryer, and that you warm their belly up with the hairdryer. And that will just help that function come back to that natural balanced state. Or a heat pack, as long as you're present with them, so they, it's not too hot and their skin doesn't get burnt. And maybe even a warm bath can be beneficial as well.
That's really important. Like in the style of Chinese medicine I do, we use a lot of palpation on the abdomen. Like where there's cold, we'd say there's no yang. So that whole point of using the hot, or not the hot, but that warmness there is to get that yang back to that area, which is getting the life force of your body back there. And
that's right.
It's great that kids are so easy to respond to that stuff really quickly, right?
For the stubborn cases that maybe aren't helped with the at-home remedies, I use moxibustion in clinic, and moxibustion is a Chinese herb, mugwort or ai that penetrates the skin and creates that warmth to restore the yang, like you mentioned.
So maybe parents could try these things at home. There's not much that like it's better to try the simple things first at home, and then if that's not working, they could then go to see a practitioner who's not going to use a hairdryer, maybe. Use like one of the mocks of the super.
Something more therapeutic, right?
I tell my patients all the time to use hairdryer on their back when they've got a bad back.
Yeah.
Like if they've got such a bad back, they can't get out of bed.
Yeah.
Because I've done that myself. Like, you can't get out of bed because your back's so bad, and you just put the hairdryer on it to get the warmth, so you can get up. That's a really like that's for free. But don't put don't light your bed on fire with the hairdryer or anything crazy like that. Yeah. The difference with the hairdryer as well, just so people know, because I'm really into this, is that it's a dry heat. So when you use a hot pack all the time, you get that moisture happening because it's actually getting more, and so it's creating more dampness. So the hairdryer is a really good idea because it's like almost like that infrared dry heat that's created from the hairdryer.
That's awesome.
So it's such a great invention that we don't use.
Yeah.
Don't use it enough. I'm not sponsored by any hairdryer company.
All the power bills are going over. People are drying themselves.
Yeah, anyway, so that's good. All right, awesome. So what about, like, what if the baby has, like, constipation and they're not, like, they've noticed that their poops, they're not going.
Yeah.
And they've tried that kind of, are there other things they can do diet-wise, or what would you do in
tummy
that situation?
time. Okay. If the child is young enough for tummy time. For older children, I really love to start the day with a glass of water. A baby will often start the day with milk, which is going to help flush it through. Older kids, a cup, maybe 200 ml warm water with a little squeeze of lemon juice, first thing. Yeah. That should be habit and routine in most families, I believe, just for good hydration, clearing through the night's cleansing that the body's done, help bring some water and fluid to the brain so that they can concentrate throughout the day. So that would be step one, and then I would offer them a grated apple, maybe with some sliced up prunes first thing, and then playtime. So jumping on a trampoline, running around, that's going to create the movement that we need, or a warm bath if it's winter and it's too cold to go outside. Yeah. Swimming is fantastic. And then
I think we forget about the movement. Because, I mean, again, it's not a bad thing. Like, technology is not a bad thing, but because of technology, people are sitting more. Kids are sitting more. They're hunching over their abdomen, right, and crunching it down. Right. That's not good.
That's right. That area. Yeah. I spend a lot of time sitting in school these days. That's
true. Yep.
So outside of that, movement is medicine.
Absolutely. Yeah. Good. So one thing that I know parents have trouble with their kids a lot are like repeated infections and repeated stuff going on. Like, let's say they get sick and it's like, oh, my kid never seems to get well, and they've always got this like runny nose or this ear infection or something like that. So how does Chinese medicine look at that situation? And I guess the other thing is, like, they worry because they don't want their kid to get more and more sick, so they end up taking antibiotics, and then they want to try something natural, but they also they're in that conundrum of that situation.
Yeah. So the ear, nose and throat, according to Chinese medicine, is almost the overflow or dumping ground of the digestive system. So whatever hasn't moved through from top to bottom, that tends to reside in the sinuses, the eustachian tubes and the chest. So often cough and things like glue ear or recurrent ear infections can be adjusted by making sure that the digestive system is functioning optimally.
Yeah, right.
If a child is suffering and you're seeing the snot and you're hearing the cough and the rattly breathing and the ears are seeming congested, or you know that the child has an ear infection, that's where it's important to keep the child's diet light and pretty bland. I'd be pulling out the main key players of things like wheat, dairy and absolutely refined sugar. They're the sorts of things that create this dampness in the body that tends to create a sticky, gunky build-up in the body. So pull those out of the diet, more fruits and vegetables, plenty more water, and get that digestive system moving. And that can really help with the ears and the cough.
Yeah, when I was studying Chinese medicine back in the day, one of the things that a teacher that I learned from said, if it looks like snot, it makes snot. for kids.
Yeah.
So if they have these things that look snotty, which that doesn't work, it doesn't mean the same thing for adults.
Yeah.
Like avocado, banana. I mean, Chinese medicine really big on eating mostly cooked foods, and it's really hard for parents to just give their kids exclusively cooked foods and not raw foods. But like,
especially in lunch boxes.
Yeah.
Yeah.
I mean, it's definitely better to give them a raw carrot than like a candy bar, if you had to toss it up between those two. But yeah, if it looks snotty, if it looks thick, it's going to create that thick liquid and that phlegminess. And
And that's a great point, actually. When parents are often asking me about what are the first foods I should feed my child, and avocado and banana are one that children love, and it tends to come in my opinion, a little bit too early. That would be the sort of food that I would have later down the track. So I would make sure that they're going well on pumpkin, zucchini, carrots, potatoes, and then I would be including the avocado and the banana, and then moving on to things like meat and so on. Yeah. With the idea being of breast milk as being clear, easy to digest, formula, the next step being easy to digest, and then making the food from there as easy to digest as possible. So things like meat or like those thick things, they're much harder to digest, which takes more energy for the digestive system to process. And kids are just learning how to do that, aren't they? That's part of it. And because of that, yang is like it's not a weak yang, but they just have like immature digestive system, and it's maturing, and so you don't want to overload it before it's and so that can often be the case later on in life, and as an adult then you're sort of coming to your practitioner, and in your health history sort of like going through your diet, and you can sort of trace it back sometimes to think, oh well, I was bombarded with sugars or dairy or things like that, and that can cause people with like just to have like you said with their gut, that connection with their gut. Long-term health conditions. I think even a lot of integrative doctors, naturopaths, and other healthcare providers are really aware of how important that digestive system is, and how that is the center point for health outward from there. Well,
that's part of Chinese medicine in its like infancy, I guess. In its the very start of Chinese medicine is kind of mentioning that like the digestive system is so important, the spleen and stomach, the earth element, and then it's only just Western medicine's kind of just catching up now to like look at like if people watching this don't know, you can research the organ that they've developed, or not developed but discovered, I guess, the mesentery, which is that connection between your brain and your gut, and an actual physiological connection there, where it's not just something that like it's something that Chinese medicine's known all along, but it's it's so important that we look after our gut, and that affects our brain, and our brain affects our gut.
And even as an adult, people know and experience, if you've gone out and done the buffet and are full and constipated, it will affect your mood. You'll be grumpy, you'll be shorter fused, and it's even more obvious in a child because they're much smaller. So if they're backed up here, boof, get ready for some interesting emotions.
Great. Okay, good. So Holly, you talked about that treating children is a lot different to how you would see an adult. Maybe some parents are still like sort of wondering what is it like? Like, I mean, if you're maybe watching this and you've never even had acupuncture or herbs or anything yourself, what's it kind of like for a child to come in and see you? What would that look like?
So mother or father and child will arrive at the clinic. I often get them to come straight in, and I have a play mat down with just a few toys, once again not encouraging too much stimulation. So the child will be playing, I would have said hi, and then I think what's quite important is making sure that there's not too much talk about the child in front of the child.
Right.
So I have a pretty lengthy intake form that the parent fills out before they come in, so that engagement that the clinic is about and that consultation is about is pure pleasure for the child. I want them to be happy to come, ready to come back, because often trips to the doctor have not been the nicest experience.
Yeah,
They've had
yeah.
Lego up their nose and tweezers thrown up there, or who knows.
Yeah.
And so...
And they've got that association, haven't they?
Exactly.
I've even had kids come into my clinic, and as soon as they come in the room, there was something about the smell or the look that was too white or whatever, and they were like, freaking out because they thought that they were going to get an injection or something like vaccination or something.
That's right. Yeah. So I think that's my advantage from working from home, is that it's coming into a home environment rather than a clinic. That's why I really kind of chose to do that. And then, so the child will be playing depending on the age. I'll either talk directly to them or talk to the mother, but slowly creating rapport with the child. And then if they can get up onto the table, that's great. Some kids will fly on up there. Others are more nervous, and so they can sit on the mother's lap, and they can sit wrapped onto the mother like this if they're quite, distressed or clingy, and the treatment can still happen while they're treated like this.
That's good. Yep.
And with that advantage of that immediate relaxation effect that the Shonishin has, I can be treating them, and then slowly they will just warm up to the process.
Yeah, okay.
So next time they might be happy to hop on the table and mum stand next to the table.
Yeah.
And so once the treatment has taken place, whether it's Shonishin or occasionally the acupuncture, some of the warming technique, the moxibustion, then the child hops off the table, continues to play. I talk to the parent about some extra at-home care, and then they leave. So it's a maximum of 30 minutes.
Okay, that's good.
Yeah.
Yeah, so parents can fit it in like after school or something like that, and it can be part of their lifestyle pretty easily. It's not going to take up a whole day just to have an appointment sort of thing.
That's right.
Yep.
That's right.
Great. Yeah, good. And what about like sometimes, let's say the child really doesn't want to have the acupuncture. What happens then? Like the kid's like really, and the mum really wants the parent, because I've had some situations like that myself, and the mum wants them to have the treatment, and the kid's like, I don't really want to do it.
I will always respect the child, because ultimately it's their body and it's their choice. It's not the sort of medicine that I do isn't life-saving. So it's not essential that they have that acupuncture point.
Yeah, right.
If they were having anaphylaxis, yes, I would be holding them down to give them the treatment they needed if I was a medical doctor.
Yeah.
But this sort of medicine isn't like that. So I also have something called press needles, or they can be called tacks, robot stickers, magic buttons, whatever resonates with the child. Yeah. And so for an infant, they're 0.3 of a millimetre, so they don't penetrate the skin.
Right.
They just sit on top of the skin and generate a light sensation on the acupuncture points.
Yep.
Otherwise, for older kids, they just gradually step up in size, and I use the larger ones with adults. So you move around, shower, swimming lessons, everything, knowing that they've got that bit of a stimulation on that point. So I can, while they're playing, I can just stick a little sticker on their hand or their knee, and it's painless and
they don't even
still
realise it's
therapeutic.
happened. Yeah.
Exactly.
Yeah, well, that's good to know. So maybe hopefully parents watching this are sort of a bit more informed about the different options there are for kids within Chinese medicine. That's not just, we've talked about the sticking, what do you call it, the robot stickers?
Robot stickers, yeah.
So like press needling or those robot sticker needles. And I guess you wouldn't call them needles to kids, but then there's moxibustion, there's the Shonishin, there's different kinds of massage techniques, like you mentioned, Tuina, which is Chinese massage. And then there's Chinese herbs. Do you give kids herbs?
Give kids herbs, yes. For the ones that haven't responded to the previous treatment. Yeah. For me, it's always less is more, and for children, exactly. They only need an invitation in the right direction and they get better.
Okay. Yep.
So that I keep that one in my back pocket unless I feel that's absolutely necessary.
Yeah, okay. That's good to know. There's lots of different ways.
Many different ways. Yeah.
Good. Awesome. Well, it's been so wonderful to have you here and to interview you. And just like I've learned heaps about Chinese medicine that I didn't know, and how to hold a baby properly. Should I that day ever come along? But next time I go around to my nephew's place, I'll be able to give him that little exercise to strengthen his back. So that's good.
Great.
So fantastic. And if people are interested in seeing Holly at her clinic, then we'll put the description below, and you can see all her the different aspects of what she does in her clinic through there if you want some more information about that. And so yeah, fantastic. And yeah, if you've got questions or comments, please put them in the comments below. We love to see your questions and answer them. If I can answer them, I will. And then we can, if it's been helpful to you, if it's been useful to you, then yeah, consider using Chinese medicine for your kids. Or yeah,
a gentle, non-invasive, and therapeutically fantastic option.
Yeah, fantastic.